And there are reported cases of meningitis in some senior high schools in the country. And already, well, we've heard that a number of fatalities have also been recorded alongside the fatalities of swine flu as reported in the Kumasi Academy. And we have to now bring the issues to us. We have to discuss them. We need to know as family members, as workers, as colleagues, etc., what we need to be looking out for and what really meningitis and the other related viral and bacterial infections are. But Dr. Ebenezer Oduro-Mensah is a medical superintendent of the La General Hospital here in Accra. We decided to bring him into the studio to help us have some identification made, what we need to look out for, etc. And we're grateful that he's here. Good morning to you, Dr. Oduro-Mensah.
Thank you very much.
But meningitis, when we say meningitis, what really is it?
Well, good morning once again to our listeners. The brain, okay, and the spinal cord have a lining that covers them, that protects them. And when this lining is supposed to be sterile, and the contents of that lining is supposed to be sterile. That is, there should not be any foreign body in it. When a foreign body goes beyond this lining, then the lining kind of reacts to the presence of the foreign body. Okay, and that's what in scientific terms we say there's inflammation of the meninges, and we call meningitis. So basically, there's an infection of the meninges, and the meninges cover the brain and spinal cord, which are delicate organs of the body which should not have any foreign body in them.
What you call the foreign body? What could they be?
Well, as I said, it's supposed to be a sterile part of the body. So anything that should not be there, but usually we talk about bugs, bacteria, viruses, and other sorts of infections.
How do they get there?
Well, commonly it's through the bloodstream. For one reason or the other, these bugs get into the bloodstream, and then the bloodstream moves all over the body. It eventually gets into the meninges, the brain, the spinal cord area, and they diffuse out of the blood into these spaces, and then they cause the infection. Occasionally, it can be by direct introduction. So if there is a road traffic accident, but these are uncommon, then you can have direct introductions, etc. But commonly, it's through the bloodstream.
Okay, and how come they get into the bloodstream?
Okay, let's look at it this way. A healthy person, okay, has intact membranes protecting them. Okay, so our skin, for example, when it's intact, bacteria, viruses are unable to penetrate. The same thing happens with our airways, the nostrils, and the airways that go into the lungs. Now, occasionally, okay, the lining may be, in quotes, injured. You may not see it. Okay, a cough, okay, sneezing can injure the lining. But cold or harmattan weather can irritate the lining and cause injuries. These bacteria, for most of us, they are still in our nostrils. Okay, about 10 to 20% of the population carry them. It doesn't cause disease because we have a strong immune system. We don't have any breaks in our lining, skin lining in the nose, etc. But when there are breaks and your immunity is low, they enter the blood. Okay, it's like getting an injury. You see blood. So if there's any organism outside, it enters the blood.
Because there's an opening.
There's an opening. So basically, that's how they get into the bloodstream, and then they travel around. And eventually, if you're not lucky, they get into the brain, and then infect the meninges, and you have meningitis.
So under what conditions or the environment would we have perhaps some of these foreign materials, or let's say the virus and the bacteria, festing or manifesting?
Well, I've spoken about.
Yes, but like for example, I'm taking cue from, let's say, the schools. Under what condition could it be? So because we have many people who live in one bedroom, and there are many of them in the same room, you know, and we know the same condition could be existing in the school. That's why I'm asking.
Yes, I think I said earlier that it may have something to do with immunity as well.
Okay.
Now, let's take school conditions where there's overcrowding, etc. If you look at how these bacteria are spread, it's human to human spread.
Okay.
When you cough, when you sneeze, you release droplets. Okay. And these particles float in the air. Okay. They may not survive for too long, but maybe they may survive long enough to contaminate and infect the next person close to you. If you exchange saliva, so for the lovebirds, if you exchange saliva, even on a piece of glass or something, you leave saliva on it, those who share lip gloss and things like that, okay, and your colleague uses it, if they are in the saliva, it can spread to that person. Okay, and as I said, 15–20% of the population may harbor these organisms in them, so we call them carriers. They may not manifest the infection or show signs of disease, but when you get it and you are unlucky, because of immune system, you can get it. Now, when you take places like schools, where there's overcrowding, not just schools, military barracks, kindergartens, etc., where there is a lot of overcrowding, what happens is these droplets do not have to travel far to get to the next person.
Because of the proximity.
Because of the proximity.
Of the subjects.
Yes. So then it's easier for somebody to pick the bag up. So if you have prolonged close contact with somebody, a small room, there are quite a lot of people there, then it's likely to spread.
I see.
So if you look at Ghana, for example, during the cold weather, Harmattan, it tends to spread, okay, especially in the northern belts. And that's one of the reasons why.
Because of the dryness, the humidity.
Because of dryness, humidity, it injures the airway, okay, causes abrasions
in the lining.
In the lining, so they're able to go into the blood and move into the brain. During the dry season, people tend to crowd because of the cold in the night, and because people tend to get closer to each other. When one has the bug, easily transmits it to the other person.
Okay, so if we have those conditions pervasive or prevalent, then what do you need to do? You keep keeping that place moist or drinking water? Or what do you have to do?
Well, you just said one. Keeping the airways moist. One way is by drinking a lot of water. So your throat does not get dry.
It's not you physically putting water.
No. If your throat doesn't get dry, then there's less chances of injuring the lining of the throat. You also, as I said earlier, it's spread by coughing and sneezing. So it's basic infection prevention practices. When you cough, you cover your nose, not with your bare hands, of course, but you use a piece of tissue or something. If you don't have anything at all, you can use this space, your elbow space, because you're unlikely to touch anything with that space, okay, to cover your nose and sneeze or cough. Okay, but ideally, you should have a receptacle, a piece of tissue. Even handkerchiefs are not the best, because you use them and you put them back in your pocket. But if you have a tissue, you cough, you dispose of it and dispose of it properly. If you have there's somebody you're in close contact with who has signs and symptoms of upper airway infection, sneezing, coughing, etc., that's not the time to play lovey. You need to keep your distance from that person for a while so that they don't transmit these bugs into you. I think the health system should have a very strong surveillance. But personally, what you can do is to avoid this close contact with those who are potentially infected.
That is, these are the things within the range of a normal
individuals. Yes.
Okay, but medically, can you vaccinate or immunize people? That kind of talk.
Yes, that's for the health system to do, and it is possible. I do recall that somewhere in 2012 there was a mass vaccination campaign in the 3 northern regions. And I think that has significantly reduced the incidence of meningitis. Really, meningitis has been with us. When I was in medical school, it was one of the conditions we kept seeing. The people were dying from meningitis. It wasn't so much news then, because it wasn't unusual. But now, after the mass vaccinations in the northern regions, we see less and less cases of meningitis. So 1-2 cases, and then everybody's like, what's happening? So since 2012, the numbers have reduced. There are mass vaccination campaigns in the northern regions, and now it's part of our immunization program. So since last year, 2016, It's been part of immunization program. So we hope that we'll see less and less of cases of meningitis.
There are people who may be living perhaps maybe in urban, peri-urban and rural areas.
Yes.
Perhaps maybe they can't afford to go vaccinate or immunize. Is that possible? Can I just walk to, let's say, a facility or my regular clinic or health facility and say, oh, I want to have some vaccination against?
Well, it's not a vaccine you usually recommend as routine for everybody. Okay, if you are not moving into an endemic area or a prone area, you may not necessarily need to go for the vaccination. I rather recommend that for those of us who have kids, the teens, okay, schooling in the northern regions, probably it's a good time to get them vaccinated.
Well, things are happening in Kumasi, Middle Belt, or they all fall in that category.
Well, not necessarily. At least in Kumasi, we are not sure it's
meningitis. Okay, I'm sorry.
Okay,
I'm sorry.
But in the northern belt, we know that that's where we're getting that's the meningitis belt, and that's where we're getting the cases. So if you have kids there, it's advisable that you get them vaccinated before.
Well, in Kumasi Academy, the April case was a meningitis case.
Well, it's kind of
yeah, but I want us to move our attention from the peculiar situations. We may look at the factors and all that. But so you're saying I can't just walk Roland, or let's say Israel, or let's say Ebenezer. Yeah. I can't just walk to, let's say, the Total Clinic and say, Dr. Deban, give me any.
No, you can. You can. What I'm trying to avoid is having the entire crowd population rush to health centers,
because usually that's not.
Yes, because
that's not ideal.
That's not ideal, but you can. That's why I said if you are sure you're moving to a prone area.
No, I'm not moving. I'm staying. I just live in Tema, so.
Well, you can. Nothing stops you from going for the vaccine. Okay, the vaccine is protective. Literature varies, 5 to 10 years, something more than 10 years.
Oh, sir.
But ideally, yes, you can go for it.
Is it expensive?
I don't have figures in terms of the cost, but I doubt it is. Most vaccines are 15, 20 cities, 30 cities. Yes.
Now, I want to know, why is it that in Ghana, or ideally, would it be possible to have mass vaccination for students, ideally, in a certain geographic area in a country? Is it ideal?
Well, if that area has been identified as a prone area.
Well, we've had the 3 northern regions reported constantly.
Yes, and in 2012,
but it doesn't look like we usually do that.
Well, in 2012, there was a mass vaccination in the 3 northern regions, so it's possible.
Those who have finished schools, maybe they have.
Well, yes, they have. Yes, it's possible. Now, when you have an outbreak, okay, an ongoing outbreak, then ideally you want to vaccinate all those within the geographical area. If the outbreak is settling, usually you go for prophylaxis for the close contacts. You may not necessarily need to vaccinate all those in that region. Again, I said that because of what has happened in the past, we are seeing less and less cases. So you may not necessarily need to go and vaccinate the entire area because you've seen 2 or 3 cases. So you might want to localize it and probably go in there and conduct your vaccinations or prophylaxis. Okay.
So what is creating the panicky situation then? Is it the media that's concerned, social media, and so create? Because you, the health people, you seem to have it under control. You seem to have a very cool temperament towards it.
Well, I believe we need to understand what is happening. Okay. Meningitis is one of the infections or medical conditions we see, just like malaria, etc. Only it has a higher fatality. Okay, it's a bit more difficult to diagnose. It starts and you might start treating malaria, but within 24, 48 hours, it can kill. That is the challenge with meningitis. That's why we need to be concerned and we need to talk about it. But then it doesn't spread as much as we may be talking about. And I think the health system, as at now, is on top of it. The health system is on top of it.
How can we constantly do education beyond maybe radio and TV? Let's say we have markets, we have people sleeping congested, because we have communities that, low-income communities in Accra, Kumasi, and main city centers, and peri-urban areas. How can we do the education in such a way that everybody gets to hear? and just become aware. Not necessarily that they have to go and rush to the hospital and do all the things that they don't have to do.
I think aside the general education we do using the media, we can do targeted education. We know the periods during which there's an ascendance in case of meningitis, during the dry season. So you target education during this season. You look at the prone areas, take your messages there. Currently, we have schools were in session. Okay, so you go to the schools, you educate them, in these prone areas. So basically, targeted education will be more beneficial than open education because people might not relate to it when it's broad. But then when it's targeted towards them, they know that, yes, this affects me. That's why they are coming directly to me, and they are more likely to respond to the education.
Parents have a lot of their children, or perhaps wards in many of these schools. So ideally, it's normal that they are worried.
Yes.
But what should we tell them for them to know that such situations could be under control? Could be under control.
Well, first of all, the parents themselves need to understand the condition we are dealing with, and then they need to also talk to their children about it. Basic infection control practices, and that's what they need to teach their children. Okay. Again, as I said, the health system needs to do a bit more in terms of education in those areas to allay the fears, the ongoing fears, especially in the 3 northern belts. Parents should try and get hold of literature and get to understand some of these conditions, because we talk to our kids, the kids listen to us. If you panic and move your kids, you might end up rather spreading the infection beyond the borders of control. So when we understand the condition that we see, we are better able to support our kids and support the health system to manage them. Our parents should not be scared, although, yes, there's been a death. But if we ask our kids to follow basic infection control practices, avoid overcrowded areas, do not expose themselves close to people who are sneezing or coughing so much. And then I think one of the biggest challenges has been in schools, access to healthcare. That's the school health program. A lot of the time you see these things in schools because the kids are not well, but because of probably the challenges of getting an exit or accessing healthcare, they stay in their dormitories, they don't go for healthcare 24, 48 hours until it's such that it's serious. So by the time they seek healthcare, it's late. So I think that is an area we critically need to look at, school health, and how our children are able to access healthcare. Let's make sure our kids have health insurance when they are going to school. Please, parents, make sure your kids have health insurance when they are going to school, so that if they are not well, they can easily access healthcare even when they don't have funds.
Well, thanks for the education, and thanks for passing through our studios. We're very grateful for that, and we always will call on you if we have any difficulty at all in trying to clear any message as far as this is concerned. But do we have different types of meningitis?
Yes, there are various serotypes. there are various serotypes, and that's the challenge, because the vaccines usually target 1 or 2 serotypes, not all the serotypes. So when one type seems to be, we are winning the battle against one type, another may flare up. And then the system has to start all over again and try to identify the new type that has come in and looking for vaccines or management for this. So that is the challenge we have. Yes, but there are several serotypes.
So the several, we have examples are?
We have the B, we have A, we have B, we have C, we have W. We have quite a number of them. Yes, and there are vaccines against some of them, but not against all.
I keep hearing about pneumococcal. That one is A, B, or C?
No, that's okay. We have Neisseria meningitis, which causes one type of meningitis. We have strep pneumonia, which causes pneumococcal meningitis. We have Haemophilus influenza, which causes another type of meningitis. We have viral meningitis. We have parasitic meningitis. So there are quite a lot of organisms causing meningitis.
Well, thank you very much. Dr. Ebenezer Udro Mensah is medical superintendent at the La General Hospital here in Accra, helping us do some education, understand what meningitis is, what we can do as people, as a person, what can you do as families, as heads of schools, as even students, what you need to understand. What we all need to do is to make sure we read and write. We go read about meningitis and look at what the symptoms are and what we can do quickly. If you have that basic information, for those who can't understand, read very well, you also have to spread that information. When you do that, generally, you have the situation usually under control. Well, thank you, and thanks for passing through the studio.